vertebrae. Thoracic. You should be able to tell the difference between these. So I'm gonna hold up a cervical and a thoracic. What's the difference? What's the difference?
Thoracic has a longer.
Definitely. The thoracic has a much longer spinous process. The spinous process actually points down for all of your vertebrae along your back. Sometimes if you have a bathing suit on or something and you bend over, you might even see them protruding from your skin. I have too much adipose tissue, so you're not going to see that. But so these spinous processes are pointing downwards, very long in a thoracic vertebrae. Lumbar vertebrae, this is a fake one. This is a real bone. They're both lumbar. The major difference here is the lumbar vertebrae have a short and stubby spinous process. It's short and kind of wide compared to the thoracic. Okay. Thoracic on this side, lumbar on this side. You still have that hole for the spinal cord, still have the vertebral foramen. There's no transverse foramen in either of these because they're not cervical vertebrae. They do have a spinous process. In the thoracic, it's very long. In the lumbar, it's kind of short and stubby. Lumbar vertebrae also are characterized by this portion of the bone, which is called the body of the vertebrae, is a very wide and thick. Okay, it supports almost all of the weight of the upper portion of your body. So very large, thick body compared to the cervical vertebrae that I was holding up earlier. Big difference between the amount of weight this needs to support and this needs to support. So I would ask you on the quiz or the practical, there's a vertebrae, you tell me, is it cervical, thoracic, lumbar? Characterize that vertebrae. There's a couple examples in the back here. I'll try to put them back in the correct box. Moving down from the lumbar vertebrae, we have the sacrum. Here's the sacrum. Very large. It's fused, actually. Fuses in your development. So as you age, as your body gets bigger, these bones fuse. Originally, it's about 5 individual bones. And here's the sacrum, and we have coccyx as well. Tiny. Another couple bones that fuse. We keep it in the bag because it is so small. This is an individual coccyx. I will not ask you this individually. Often we call this the tailbone. So coccyx is here in the bag. Sacrum over here. The portion that articulates with your hip bones or your pelvic bones, these are called the auricular surface. These are auricles. If you remember, the outer portion of the ear was the auricle, and it's spelled with an A. Okay, not oracle like, I don't know, telling the future kind of oracle. Oracle with an A, like the outer part of the ear. This looks like an ear, like an elephant ear, almost. So that's where that name comes from, this auricular surface.
How is it spelled?
A-U-R. Okay, pelvic bones. I'm gonna keep going down. On here, this is one set pelvis that we have. Here's another pelvis. This pelvis is female. This pelvis is male. And you will need to tell the difference between the two. So I'm just gonna hold the female pelvis up first. The female pelvis, you're gonna look at this area here, which is called the pubic arch, this pubic angle here. It is greater than 90 degrees. 90 degrees is more narrow, like in a male. The angle here is less than 90 degrees in a male. Much wider in a female as well. As we look in this way, okay, this would be where the ovaries, the uterus would be located, for example, in this pelvic cavity here. The coccyx, tailbone, points more posteriorly. Now this one moves, so don't let this throw you off. But the coccyx points more posteriorly in a female pelvis than in a male pelvis. In a male pelvis, the coccyx points more anteriorly. See, this one doesn't move. So you can see it's kind of pointing inwards. It would be a lot harder for a male than to give birth to a baby. Obviously, they don't have a uterus and so on, but it would be harder for the baby's head to fit through here from the design of the skeleton. Easier for females. This wide now area for the baby's head to fit through during labor. Go ahead,
What
Sherlock.
did you say about the degrees? That females have what?
Females is greater than 90 degrees in the pubic arch. Males less than 90 degrees. This portion is called the pubic symphysis. We'll look at this more when we do articulations and joints, but also during labor, this gets very relaxed as a part of relaxin, the hormone that's released. So it helps also to widen and loosen the hip bones a little bit.
Is that where they put-
Not usually. They wouldn't do that. They might do an episiotomy, but that's more of the like soft tissue and the pelvic floor. That's not bone wise. Okay, these bones here are the pelvic bones. Obviously, we've looked already at the sacrum and the coccyx and the lumbar vertebrae that you can see from the top, but these are the pelvic bones. What you'll need to know are the three parts of the pelvic bone. They have actually fused together at this point, but you should know the ischium, which is this back kind of inferior portion. It's very roughened. It's the part that sits on the bench or the chair. This top wide, thin portion, that's almost the hip area where you would put your hand. This is the ilium. And this front portion here, that's very narrow, kind of comes in towards the pubic symphysis. This is the pubis. So three parts to the pelvic bone: the ischium, the ilium, and the pubis. They all fuse together to make up that pelvic bone. This indentation over here in the pelvic bone is called the acetabulum. This is for the head of your femur, the large bone in your leg to articulate. So this is what's going to form your hip joint. Okay, this is the acetabulum. This foramen here is called the obturator foramen.
Can you say it again?
Obturator. Obturator. Almost like operator. Okay, another pelvic bone. This one's real. You can see it's been damaged. Okay, but you can see the acetabulum very nicely in this pelvic bone. It's where the head of the femur would be located. And you can see the obturator foramen over here. You can also see where the pubis is and the ischium of the bone, as well as the ilium. These curves in the back here is where your sciatic nerve would be traveling through. There should not be a hole here. Obviously, that bone has been damaged. It's nice, though, because you can actually see that there are regions of spongy bone and compact bone that we'll talk more about next time. So this hole really shouldn't be here. Yes?
Where's the what is it called?